Good morning. I'm Berks County Commissioner Christian Leinbach, and I want to welcome you to our Commissioners meeting for March the 4th. We are broadcasting live via Microsoft Teams live event, and you can also watch us on BCTV, Facebook Live, and YouTube Live. At this time, I'd like to recognize my Executive Assistant, Mary Buer.
Thank you. Public comment will be accepted through the Q&A function. Please include your first name, last name, and municipality. Any comments without a name and municipality will not be considered. Each citizen can submit one comment. Comment length is dictated by limitations of the platform being used, Teams, Q&A, Facebook, or YouTube. The meeting comments period is limited to 30 minutes in total. Please be concise. Comments will be read during the meeting and should not be considered to be interactive dialogue with the commissioners. Any commissioner response to public comment will be done at the discretion of the commissioners.
Thank you very much, Mary. As always, we will begin the meeting with a moment of silence, followed by a pledge to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. As we do each week, we will begin our program with the Berks County COVID-19 data report. It's being presented to us by Brian Gottschall. Brian is the director of the Berks County Department of Emergency Services, and he is also the lead for the Berks County COVID-19 leadership team. Brian Gottschall.
Good morning, Commissioner. Just give a moment for IT to get the screen share up. Okay. Yes, thank you. As you said, our weekly report for this week, March the 4th. Taking a look at the Pennsylvania Early Warning Dashboard, last published last Friday. As always, almost a week behind what we're talking about today, but all indicators in the right direction, headed downward, and happy to say headed downward at a little bit of a greater rate than it has been in prior weeks. Our local cases and testing, again, these are smooth statistics looking at testing over a 7-day period and cases over a 14-day period. We see both indicators in a downward direction. Obviously, best scenario is that we'd see testing going up while cases are going down. But the reality is that we, of course, expect that the community is not so interested in testing when we don't have such a high spread of cases in the community. The big emphasis is on the dark blue line and seeing our case counts consistently coming down from where they were in the beginning of the year after the holiday season. Our first test positivity in Berks County also on a downward trend. Again, looking at this over a 7-day smooth period, only since the fall of last year to see more detail in the graph. We see those that positivity indicator coming down, approaching 20%. Again, the difference being between what we report and what the state reports. We're looking at only first test positivity, the state's positivity number in the early warning dashboard, inclusive of all serial testing being done at custodial care facilities. Our cumulative death rate flattening out significantly. This was a big item of discussion for us in the end of January, as you recall, when we were seeing a very vertical slope in this graph, correlating to the flattening out of our case count. We also see our deaths from the disease counting out, but each week we are still adding numbers to this, and that of course is a tragedy for those folks and their friends and families. We don't want to lose sight over the fact that even one death is important to some folks. I shouldn't say to some folks, is important to the folks related or knowing the individual who's deceased. Our hospital numbers, we see a little bit of an uptick from last week, but I wouldn't consider this number significant. I think we're still following a downward to flattening trend in our hospital numbers, which is of course what we all want to see in the effort of our Flatten the Curve and our Do Your Part Berks campaigns. County comparison snapshot remaining relatively unchanged week over week as far as cases, deaths, and tests administered per capita. Some new information we have this week on the heels of our community test site that we did in coordination with Temple Oheb Shalom. We saw a very small number of folks being tested in comparison to our fall test site operation. In the fall, I'll remind you that we saw single days where we tested as many people as we did in the 5-day period that we conducted in mid-February. And again, I think that that's just indicative of the fact that there's potentially less COVID in the community, less concern among folks, and therefore less people are turning up for this testing opportunity. But a total of 388 folks sampled during the 5-day period. Pretty statistically significant to Berks County, although there were a number of other counties represented with small numbers of folks tested. We don't have any way of knowing, are they college students who are in Berks County but report an address elsewhere? Were they folks who actually traveled from those counties to take advantage of the testing opportunity? Unfortunately, no way for us to know those specifics. Just want to spend a moment here on this slide looking at the positives that came out of the test site. And you'll note that our total number of outcomes is different than our number sampled. We actually saw this in the fall testing also, around a 10% loss of tests, whether those tests were not able to be run, literally lost in the data, whatever. But in the fall, we did see about a 10% loss of tests, and we saw a similar 10% loss of tests this time around. But I want to draw the attention of everybody to the right-hand column, which is the positivity rate per age group. And we see very high numbers of positivity in the testing from 0 to 18. Now, we also see correlating low numbers of total tests. So again, in the 13 to 18 age group, we only had 16 tests conducted, but of those 16 tests, 4 of them were positive. Correlate that to the 65 plus age group where we had 123 tests given and only 9% of them were positive. So it's hard to draw any real awareness out of that. We would imagine that the folks that were tested at this test site were not particularly ill, that they were likely asymptomatic or had minor symptoms. But it is concerning that we saw that very large positivity in those low age groups. It indicates that there may be a likelihood that those folks are COVID positive, carrying the disease, but not symptomatic, and therefore potentially unaware that they're carrying the disease, but for the availability of this kind of testing. Speaks to the need to, sorry.
Ryan, if you could stick with that a minute, this does correlate to what Commissioner Barnhart shared last week on the contact tracing, and that was that consistently for some time, the main areas of outbreak, for lack of a better word, or spread tended to be schools.
Yeah, I think that Coe County had indicated, and Commissioner Barnhart shared, that they are seeing contact lists coming from schools, indicative of the fact that the contacts were among school-age children. I guess one of the things that we, of course, don't know is, was the only contact between the people in the school, or are these just simply school-age children who are congregating out of school and creating that spread? Again, we don't want to jump to any conclusions, but it definitely does indicate that there is COVID in that younger population. Large, those individuals are certainly not dying, not becoming significantly ill. The kind of bad news side of that good news is, because they're not becoming ill, they may not know they have the disease, and they may be a vector to spread it then to other people. So it continue social distancing, things like that. Moving on to our vaccine administration, this is something that's becoming increasingly complicated to keep on top of, as the data that the state is publishing is in different forms and being presented in different ways. So this week, Berks County is 15th in the number of first dose administrations and 13th in the number of second dose or fully vaccinated. A week ago, we were 13th in the number of first dose administrations and 12th in the number of second dose or fully vaccinated. And we're going to speak to a little bit more about what that statistic means and what the things are that are affecting that as we move forward. Our location map, if you will, really doesn't change much. There's still right around 30 locations in Berks County that have received vaccine. That doesn't mean there are 30 locations that currently have vaccine or are able to administer it to the public. In the last week, there were only about 7,000 doses made available in Berks County by the Department of Health. I know this is an eye chart, but I do think it's important to show it each week, and I imagine it's going to become more and more of an eye chart each week. We're going to have to figure out a better way to display it, but I think it's important that the public get to see who the kind of big players are in the community, and they of course remain Penn State Health and Tower Health. As far as the big healthcare systems with lots of vaccine, but there are some pretty significant players in the pharmacy world too. West Reading Drug, Esterbrook, and the Boyertown Medicine Shop is also getting some significant availability of doses. Again, this is the information from the beginning of vaccination. It's not representative of what anybody has this week. Oops, sorry about that. Little happy finger. So again, looking
Brian,
at
Brian,
yes.
Hold on one second.
Like
are we having a screen issue? I asked.
Yeah, it looks like a rainbow.
Yeah, you can't see what you're showing, and
okay,
maybe you want to go off the live and come back.
Yeah, let me stop sharing and start sharing again and see if that fixes the problem. Does that look any better?
I'm looking at your face right now, so you probably don't want an answer.
I show that I'm sharing my screen, and I do have the red box around my PowerPoint screen.
I believe you. Right now, the image is live on me. I see your image, but it's not sharing. There it is. I now see it. Vaccine opportunities tabular.
Yeah, I think there's a little bit of latency. My video quality of you guys is not so great, and there appears to be a little bit of a delay, so we may be having a little bit of a communication issue here. So
I think we are.
Okay, hopefully the public's able to see the vaccine opportunity tabular slide. And as I was saying, this is just our effort to represent to the public the total number of vaccine doses that each of our providers have gotten since the beginning of the vaccination process. And I will pause just to ask the commissioners to confirm that they can see. Actually, your video is clear, so I think that our data problem has gone away now. Great. Yes. Okay, so this is just showing the doses of vaccine coming into Berks County in each of the weeks up through week 11, which is last week. And we see that we did peak in week 7 with 9,275 doses. Saw a very bad week in week 10 where no doses came into Berks County. And then we're somewhat on an upswing now again, which is great news. So I want to point out to the public that some of this has to do with what's being referred to as the second dose problem, where we had providers not in Berks County, but in other parts of the Commonwealth who were giving away what were their second dose allocations as new first doses. And that then created an environment where folks who were due for their second dose would not have been able to get them unless the Department of Health surged additional second doses in there. And the only way they could surge those in, because the available allocation to the state is somewhat fixed, is to take those new first doses away from other providers that didn't have this problem. So it created a degree of inequity among the counties, in essence, where those that did the right thing were to some extent punished for doing so by losing their vaccine allocations. And all of our providers in Berks County are suffering through this and trying to work with DOH to get kind of back out to a neutral level where we fix this problem and it's not repeated going forward. So these are a couple new slides we'd like to take a look at, and I think that we'll likely want to look at these moving forward week over week. This table is ranked by population. So Philadelphia is not part of the evaluation since they get their own direct allocation of vaccine from the feds, not through the state. And once you take Philadelphia off the list, you'll recognize that the counties as listed on the screen are in order of population. And then we show how many folks are fully and partially vaccinated in each county, and how that ranks in the Commonwealth by population, per capita, in other words. So if we weren't looking at it per capita, of course, the biggest counties would have the most number of people vaccinated. What we're looking at here is if we control for population, are the numbers staying somewhat equal in that the population of the county remains ranked with the number of people vaccinated per capita? And the answer that we see here is that there is a pretty big disparity in the size of the county versus the number of people who have been vaccinated per capita. And we wouldn't think that that would be normal, because we would think that the largest counties are getting the largest proportionate allocations of vaccine. To really understand this, though, and why this might be happening, we have to move past the people that are vaccinated. And I'm sorry, I should pause and mention that there's another thing here that makes us not want to really focus on people, and that is that, of course, anybody can go anywhere and get vaccinated. So just because you live in Berks County doesn't mean you got vaccinated in Berks. These numbers that are shown here for the people vaccinated are where they reported their address. However, a really important thing to look at is the allocation of vaccine from DOH. And in the same way, we rank the counties, we order the counties by population on this list, Allegheny at the top, Westmoreland at the bottom as the 10th most populated county. And when we look at the kind of middle column here of rank by doses received, while it certainly isn't linear, we see that it kind of makes sense. The larger counties are getting the larger amounts of vaccine across the Commonwealth. But the problem that we're seeing is that even though Allegheny is getting the most vaccine, which makes sense since they're the most populated, when you control for population in the column over here that has green and red colors, we see that Allegheny is not getting the most vaccine per capita. In fact, they're 14th. And all of these top 10 counties, except perhaps Lehigh, should be expressing a significant concern about the fact that they're not getting vaccine allocations from DOH that are proportionate to the size of their population. And I want to, sorry, Commissioner, go ahead.
So Brian, yesterday I was on a call with a commissioner from Chester and another commissioner from Montgomery County, just the three of us. And we talked about this, and they expressed to me their frustration with the allocation issues from Pennsylvania DOH. And the interesting thing is, as you look at these top entities, Allegheny has a Department of Health. Montgomery County has a county Department of Health. Bucks County does. Delaware has a hybrid. Lancaster does not. Chester has a health department. They told me it's not making any difference. Yes. That they have a health department. Now, they're not knocking county health departments. They're saying they are struggling in the same way we are. I mean, look at Delaware County. Delaware County is much larger population than Berks, and they're at 52. It's pretty incredible when you look how we compare. Even Lancaster is larger than us. They're over 500,000 population. We're 421,000. Lancaster's 48th.
Yes, and
really a struggle.
Just to be clear, Commissioner, those numbers where you talk about the 52 and 48, because they're controlled for population, right, it really shouldn't make a difference whether the county's bigger or smaller. That's the thing. If doses were being allocated to counties strictly on population, we would expect that the numbers in that rank by doses would go 1 to 10 right down the list. And that's really what I want to drill into here. I wanted to provide the data to help the public to understand what the issue is, but I think we do need to spend a couple minutes talking about a little bit more about that issue. So it is our understanding that the Commonwealth is taking the amount of vaccine that comes into the Commonwealth, and then the first analysis is an allocation by county. And they've not been 100% clear on what data, what demographics they're using to allocate it by county. We know that population's got to be significant, but based on what we're seeing here, there are clearly other things that are weighing into that decision about how much vaccine is going to come into a county. And they've told us that it's based on a number of demographics and of just normal demographics, things like population, socioeconomic status, those types of things, but it's also based on COVID demographics or statistics. So positivity, case count, those kind of things. So we know there are a number of moving parts in this analysis, but what the Commonwealth explains to us is once they decide how much is going to come to a county, then they decide how much is going to go to each provider within the county. So the point of this is to say that while certainly the number of points of distribution are important because it makes it convenient and easy for people to get to, the reality is that if we had 100 places to go and get a needle in your arm, it doesn't change the amount of vaccine we're going to get from the Commonwealth of Pennsylvania. And therefore, there's some reasonable consideration to how many different places do you want to build to give vaccine if the amount of vaccine that we're getting isn't changing. And I would equate this to gas stations. You can build all the 20 pump gas stations you want, but if no tanker truck is coming to put gas in the underground tanks so that it can ultimately be put in cars, you really haven't accomplished anything. And this is the problem that we have right now. We have a fairly significant capacity to deliver vaccine in Berks County. And we're building more of that capacity, both among our private sector and private nonprofit partners, as well as the efforts that the county's putting in place to stand up a healthcare agnostic vaccine clinic. But at the end of the day, the controlling feature here is really the amount of vaccine that is coming into Berks County. And your analogy, in looking at Montgomery and Bucks was saying that they have health departments, Commissioner. Yes, but I spoke to my counterpart in Bucks County. They have 3 county-managed, county-sponsored vaccine clinics in Bucks County that are using vaccine that is being allocated to the Bucks County Department of Health. But it doesn't mean they're getting more vaccine than if they didn't have those 3 clinics. It's just that the vaccine that's going to those 3 clinics would instead be going to other providers in Bucks County. So it truly is a matter of the size of the pie, and you can divide the pie up in many different ways. And in some ways, it makes sense to divide the pie up into smaller pieces to have more opportunities for folks. But at the end of the day, you still only have so much pie. And that's the part that's very concerning. We understand that the Commonwealth can't make more pie. They only get a certain amount from the federal government. But the Commonwealth certainly does have the capability to make some very important decisions in how they divide up what they get from the federal government. And the concern here is that when you look at these doses by 100,000 of population, there appears to be things that are driving that decision that are not clear to us. And I think it would be very helpful for us if the Commonwealth could better understand, could better explain it to us so that we could help to better explain it to the public. And I know in that case, I'm preaching to the choir as you guys were part of the request, but for the benefit of the public, this is why we've sent this request to the Commonwealth, shown them the data, and asked them to help us better understand what makes Delaware County 52 on the list of getting doses per population. What makes Berks County 41 in doses per population? So that's the conclusion of the report for this week, Commissioner. Certainly, we've had some dialogue there. I don't know if there are further questions. We went on pretty long, but I thought it was important to bring out a couple of key points there.
Any additional comments or questions? Okay, we'll turn it over to Commissioner Kevin Barnhart for the Coe County Wellness Contact Tracing Report.
Thank you, Commissioner Leinbach. Good morning, everyone who has joined us on this call. Our data for the past week, February 24th to March 3rd, there were 573 new contacts compared to 269 the prior week, reaching 419 contacts at a 73.2% success rate, pretty close to last week's at 73.5. Total since the inception in June, they have contacted well over 9,000 people. And just adding to the conversation about the high percentage, I think it was 76% of people 0 to 18 years of age at the testing site at the synagogue. We again have 34 line lists, which are large exposures, and each and every one of them are educational institutions throughout our community. So it is very critical. I think this kind of dovetails into the governor's announcement, I believe yesterday, to start vaccinating those who are in the education business to try to get them back to safety and also back to education. Another component we're working on, and there was a little teaser out the other week regarding a community vaccination clinic. We are moving full ahead on that plan. We have a tremendous partnership with myself as chair of the task force, Pam Shook, who is our chief deputy administrator, Brian from Emergency Services, Matt Salkowski, our facilities director, Jessica Jones from the Agency on Aging, Amy Resch and Allison Troutman from our library system, Carolyn Basic and Barbara Waller from Co-County Wellness, and Vicki Widener, the director of Shared Ride Services at BARDA, and a local healthcare provider. We are ramping up, going to be planning this over the next few weeks. This site will be on a major bus route in Muhlenberg Township. We will be providing free fixed ride and shared ride services. So if you are able to get on the bus and get out to Muhlenberg Township, it will be free. Also, we'll be coordinating with Vicki Widener at BARDA to provide door-to-door service on shared ride. It's great to have these community partners. Co-County Wellness will be starting up a call center to be primarily utilized by people who do not have technology or are not technologically savvy. We are going to basically limit, once we know how many vaccines will be provided on a weekly basis to the local healthcare provider, that's about the number of appointments we're going to take. There will be a software component to this, but there will also be the ability for someone who does not have technology at their home to call in. We're going to really ask people to call in who need that and the transportation to and from the vaccination site. It's very important we do this. We're trying to put all these components together. It's still a few weeks away. There are some upgrades we need to make to the facility. It will be indoors. It will be climate controlled. So as we go through the spring and even into the summer, it won't be an issue that we can't conduct these clinics outside. Again, it all dovetails into how many vaccines come into the community, how many come into our healthcare provider partner to be able to do this. So for example, if we are aware that we're going to be getting 1,000 vaccines, the list will probably be a little more than 1,000 people. It's not going to be 50,000 people. We don't want to turn people away or have people go on multiple lists. It's very important that we control that number of people to come through the clinic. So we are moving forward on this. We're having weekly meetings with our partners. The Area Agency on Aging is going to help those who are, again, don't have the technology or loved ones to support them to get signed up. The major takeaway for today's discussion is go on doyourpartberks.com. Sign up for the newsletter. That's the county's most effective way to get the message out instantaneously. It's great that you sign up for the newsletter. There's a lot of great information on vaccinations, locations that are presently in Berks County. It's a lot of information. We want to get a lot of people signed up on the newsletter, doyourpartberks.com, because as we ramp up and then we have the vaccines to open the clinic, that will be your message to say, by the way, they've received X number of vaccines. They're opening the window to schedule an appointment, and then the window will close. Again, we're not going to build up these lists like I was speaking to someone I know last night. They're on 4 different lists waiting. We don't want to be that 5th list. We don't want to be that list that gets people vaccinated and on their way. Again, we don't know what vaccines we'll get, when we will get them, whether it's Moderna, Pfizer, or J&J. We're not really sure. So again, this will be a one-stop shop for people in Berks County who have not been able to receive their vaccines thus far. And it's probably going to be open at least through August of this year. as we ramp up the amount of vaccines coming into the community, we'll be obviously prepared for it. Again, we're trying to eliminate the frustration that people have who do not have technology, who only have a phone as their source of information. We're utilizing Cook County Wellness. They're going to be ramping up staff and training staff to take the calls. The healthcare provider will still continue to provide vaccines at their locations, but they too will be ramping up with people doing nothing more than the vaccines. All of this falling under the umbrella of being financed by Berks County and its residents to provide this location, to provide the staff for Cook County Wellness, and provide the staff for the vaccinations, as we have been doing from the beginning in June with Cook County Wellness reimbursing them for their contact tracing services. So a little more information than you had 2 weeks ago. Once we get more finalized dates and we start to see a greater influx of vaccines into our community and the place is ready to go, we'll start this up. And there'll be some bugs in the beginning, but we want to encourage people not to call the ones I just articulated. Do not call Area Agency on Aging, please. Don't call the libraries. Don't call emergency services. Don't call here because there's nothing really to tell you at this point. But we are ramping up. We're still looking at a final software package. The call center is getting new technology, some upgrades in the phone system. That's going to happen in the next week or two. So it's all in the offing in the next few weeks. So please be patient. If you can get a vaccine somewhere else, please go get the vaccine. If you can find a location, get one. Please don't wait for this place to open. This place will be in addition to what's already taking place in Berks County at all the other various facilities that have been articulated by Commissioner Leinbach and Brian Gottschall. So again, thank you to our board and to everyone who's been involved in this to get this thing up and running for the community. So as we see more vaccines coming in the community, people are going to be more inclined to be able to get these vaccines quicker than has rolled out the last 12 or 13 weeks. If there are any questions, I'm more than happy to answer any. Christian, you look like you had a question.
No,
Okay.
I just want to reiterate that we've published a link to doyourpart.com, the website, but specifically to the vaccine page. That page is loaded with valuable information, links to the state GIS map, links to Tower Health, links to Penn State St. Joe's, links to Berks Community Health Center, phone numbers that you can share with people who do not have access to technology for Tower Health and Reading Hospital. And those phone numbers are specific to people that cannot use the internet, don't have access, don't have a smartphone, etc. So I encourage you, if you're watching this show, to go to this link and share that information with others. It's also been posted up on our Facebook page and on our YouTube page.
If you learn nothing more from this little presentation this morning, we are here for you. We've pulled the right partners into this group, and it's going to be made available. And I want to thank all those partners for their dedication to our community. And stay tuned for more information as things start to get more solidified. And do your part, Berks.com, sign up for the newsletter. Very, very key information as we move forward. Thank you.
Absolutely. And that sign up pops up automatically when you go in. So hopefully everyone will take the opportunity to do just that. We will continue with our meeting. Are there any additions or corrections for the February 23rd operation meeting minutes, February 25th commissioner meeting minutes, and the March 2nd operation meeting minutes? Hearing none, the minutes will stand approved as presented. I want to note that we had 2 executive sessions since our last meeting. March the 2nd, dealing with personnel and litigation, and March the 3rd, dealing with personnel, litigation, and contract negotiations. Mary, are there any public comments on specific agenda items?
There are none.
Thank you.
Okay.
Under number 1, authorizing, under that, Budget Department, adopt a resolution authorizing 2020 budget transfers in the amount of $46,088, 2020 appropriations in the amount of $2,772,678, 2021 budget transfers in the amount of $59,394, and 2021 appropriations in the amount of $4,895,179 per listing dated March the 1st of 2021. We have several items listed under the Commissioners. Item A, adopt a resolution authorizing execution of the Pennsylvania Commission on Crime and Delinquency Capital Case Indigent Defense Grant application in the amount of $20,000. The funds would be used for a mitigation expert for a capital homicide case and would be available from July 1 of 2021 through June 30th of 2022. Item B, adopt a resolution authorizing execution of the Memorandum of Understanding with Berks Connection Pretrial Services concerning the Second Chance Act community-based reentry program for a 3-year term beginning October 1st of 2021 and ending October 1st of 2024. Item C, adopt a resolution authorizing execution of a letter of support from the Berks Board of Commissioners to the Pennsylvania Department of Conservation and Natural Resources for the Colebrookdale Railroad Preservation Trust application for funding through DCNR C2P2 Park Rehabilitation and Development Program for the Memorial Park Recreation Accessibility, Safety, and Connectivity Improvements Project. Item D, adopt a resolution accepting and authorizing execution by the Berks County Board of Commissioners of the Emergency Rental Assistance Program for fiscal year 2020-2021 from the Pennsylvania Department of Human Resources in the amount of $15,150,690.51, and further authorizes Berks County Redevelopment Authority to administer the emergency rental assistance funds on behalf of the County of Berks. Item E, adopt a resolution authorizing the chair to execute the project change requested dated February 18th of 2021 to the Tyler Technologies contract for additional modification to the STEB report. This is a $0 change request. Item F, adopt a resolution ratifying, confirming, and approving execution by the chair of the temporary easement for construction between the County of Berks and Reading Bucket Services LLC, Reading, PA, to erect and maintain scaffolding on county property at 35 North 6th Street in Reading in connection with a renovation of the Berks Trust building. Just for clarification, this is not a renovation the county is doing. This is a renovation of a building next to the county courthouse, and it's being renovated by Human Development. Item 2, a motion authorizing execution of contract agreements and amendments as furnished by the contract coordinator as set forth on the attached listing dated March the 2nd of 2021. There are a total of 2 contracts, one with the Berksheim and one with Human Resources. And then finally, item 3, a motion to ratify and confirm payments as set forth on the Controller's Office voucher listing dated March the 2nd of 2021 and payment of electronic transfers and employee payroll.
Motion to approve the agenda is presented.
Second.
The motion has been made and seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? The motion is carried. We'll turn now to our County Treasurer, Dennis Adams, with the Treasurer's Report.
Good morning.
Good
Looks
morning.
like we're finally getting some better weather here.
Yes.
We have an opening balance today of $162,772,484.99. A balance to clear of just $2,136,047.61, leaving us with a balance of $160,636,477.48.
Thank you very much, Dennis. We'll now go to our County Controller, Sandy Graffius, with the Controller's Report.
We had a total accounts payable of $7,676,788.60, and we had a payroll this week of $4,469,364.58 for a grand total of $12,146,153.18.
Thank you very much, Sandy. We'll move now to our Chief Administrative Officer, Ron Seaman.
Thank you, Commissioner Leinbach. There's nothing to be reported at this time.
And that quickly, we are to Commissioners' reports, and we will begin with Commissioner Kevin Barnhart.
Thank you, Commissioner Leinbach, and good morning, everyone again. Two items. At 11 a.m. this morning or thereabouts, we have our election board meeting where we'll be discussing the rollout of the electronic poll books, which have been certified by the Department of State with some recommendations, and whether or not to use the arena for the primary for the purpose of additional polling locations and the counting of mail-in and the other paper ballots, and the utilization of BCTV to record the counting of the paper ballots. So that's all coming to you at 11 a.m. this morning, or close to 11 a.m. And I've mentioned in the previous weeks, I continue to dig through volumes of paperwork regarding other departments of health in the Commonwealth. Last night, I spent considerable time going through Erie County's documentation on a county health department. So thus far, I've gone through state documentation, Allegheny County, Chester County, Delaware County's plans to start up a county health department in Erie County. So it's in a real research phase right now. There's an awful lot of information that's very valuable, key indicators in those communities, and they run the gamut from obesity to low birth weight, smoking, binge drinking, all those sorts of things. So again, I've mentioned this numerous times, there's a lot to go through. There's an awful lot of responsibility that comes with standing up a county health department. So I just want people to have their eyes wide open and their ears wide open, because this is not a snap of the finger and you decide, hey, look, we'll have more vaccines if we had a local Department of Health. There's an awful lot that goes with it: staffing, financing, working with the other municipalities in the county who may have some other components of health officers in those communities. You're taking on 15 to 20 different functions that are presently being done by other agencies, including the State Department of Health. So more to follow as I dig through this paperwork, but thank you for letting me explain that. I spent a lot of time at night trying to listen to the television set while I'm reading through documentation. So thank you very much.
Thank you very much, Commissioner Barnhart. We'll move now to Commissioner Michael Rivera.
Yes, thank you, Commissioner Leinbach. Just two items that I've been mentioning for the last couple of weeks, but I want to make sure that the information gets out there. The Emergency Rental Assistance Program, the application start date is this Monday, March 8th. We had the Commissioner's Weekly Update yesterday on that, so if you want to watch it, you can go to our county's Facebook page or our YouTube page and watch it there. It's full of information. Also want to thank the Hispanic Center for the assistance they're providing in helping Spanish-speaking people fill out the application and walk them through the process. So thank you very much for the support that the Centro Hispano is giving to this program. And also for more information, you can go now to doyourpartberks.com or the Berks Coalition 10 Homelessness, which is bceh.com, bceh.com or doyourpartberks.com for more information on the program. And I want to thank the Berks Coalition 10 Homelessness and the Berks County Redevelopment Authority for putting this program together and for doing a great job at it. We're looking to be able to assist as many people as possible. Also, the hospitality industry grant program. We will have our weekly update on that this coming Wednesday at 3:30. So if you're available, join us. You'll be able to find the link at our website. To the right-hand side, you'll see it says online public meeting information. Click on there and you'll be able to access the link for that weekly update, which is again next Wednesday at 3:30. And we will have the Greater Reading Chamber Alliance on there, and they are the organization administering this program for the county. And you can find more information on that program. It's already up at rebuildberks.com/funding, or simply rebuildberks.com. And there will be a link there on the page that you open up to be able to take it to this grant program. So please help us get this information out. There are 2 great programs which will benefit our community greatly. Thank you very much.
Thank you very much, Commissioner Rivera and Commissioner Barnhart. One item I want to report on. Last Friday morning, I was on a call with the CCAP COVID Task Force at 11 a.m. with staff from the Governor's Office, from the Pennsylvania Department of Health, and from PEMA, Pennsylvania Emergency Management Agency. We specifically talked about the vaccine allocation issue relative to the unwillingness at the time of Pennsylvania DOH to focus attention on mass vaccination sites. We pressed on that very hard. At 11:30, we spoke with the governor. I spoke to the governor specifically about Berks County, about the vaccine allocation, and the issue around mass vaccination. The governor said on that call, in response to my question, that he believes we need to look at this and that we need to do both. And that is continue with the small allocations to local pharmacies, but also look at mass vaccination sites where they make sense. There's some indication following that meeting that indeed is something that they are taking seriously. We saw last week and now again this week a commitment to locally owned pharmacies. Last week, Esterbrook Pharmacy in West Reading received 1,300 vaccine doses. And this week, the medicine shop in Boyertown, which has been doing quote unquote mass vaccination, they have taken their allocation in past weeks, working with the Boyertown School District, the Boyertown Multi-Services Center, which is a local senior center and Meals on Wheels, and the Berks County Area Agency on Aging, and getting it out to the most needy folks in that community. Ed Hudon, who is the owner of the medicine shop, spoke with me on Thursday, and we communicated over the weekend. He was ecstatic to be notified that they were receiving 1,100 doses. So there seems to be movement in the right direction, but as Brian Gottschall shared, there is a significant disparity when you look at counties like Berks, Lancaster, Chester, Montgomery. In fact, most of the southeast counties, apart from Philadelphia, are way below where you would assume they would be if there was an equitable distribution of vaccine relative to per capita. And we've shared that information last week with Department of Health, asking for answers and an explanation. We're waiting to better understand that. Again, though, we want to highlight it's not all a Pennsylvania issue. It continues to be a challenge on the availability of vaccine. That is controlled by the federal government. The Biden administration has made some significant commitments in recent days relative to the Johnson & Johnson one-dose vaccine. We understand now that Merck is going to be those of you that have access to the internet. I believe the most definitive site on vaccine for Berks Countyans and even beyond is the Do Your Part website, going to the resource tab and choosing vaccine. It ties into resources at the state. It also ties into local resources. And as I noted, if you have friends or neighbors that do not have access to the internet, there are phone numbers, Fort Tower Health, Reading Hospital, and Penn State St. Joe's on that website that you can share with them that are specific for people who do not have access through a computer. We don't want people calling those numbers that have access through a computer. Those are specifically dedicated to people that lack that kind of access. With that, I will turn it over to any row officers with comments. Okay, we will go now to public comment, and I will recognize Mary Buer, my executive assistant, to read public comment.
Thank you. Fred Zencraft Sr., Berkshire Heights. Greetings, commissioners. A free and fair November 3rd, 2020 election would have continued and improved upon President Donald Trump's accomplishments, some of which follow. Delivered a future of greater promise and opportunity for citizens of all backgrounds. Unemployment rates for African Americans, Hispanic Americans, Asian Americans, Native Americans, veterans, individuals with disabilities, and those without a high school diploma all reached record lows. Unemployment for women hit its lowest rate in nearly 70 years. Lifted nearly 7 million people off of food stamps. Poverty rates for African Americans and Hispanic Americans reached record lows. This is a small part of the January 2021 White House showcase list. The current administration policies will have a negative impact on these positive accomplishments to the detriment of our posterity. In every election, all parties should know the ground rules well ahead of time. Just like in financial systems, there must be standardized internal controls to rule out any possibility of illegal conduct. There can be no ambiguity. There can be no opportunity for counties to handle matters differently. There must be clearly defined rules and uniformity across the Commonwealth. To change the rules during the race and even up until the votes have already been counted is wrong and undermines the election process. That is what happened in this past election. That is why faith in the election system has been shaken for many. Copied from January 19, 2021 letter to 2 Pennsylvania legislative leaders from numerous county commissioners, including Berks County Commissioners Leinbach and Rivera. The previous paragraph I could not agree with more, as well as the entire letter contents, and appreciate effort to address travesty of the November 3rd, 2020 fraudulent election. Keep up the good fight for free and fair elections. Thank you and Godspeed, Fred Zencraft. Sam Brancadora, Bern Township. Good morning, commissioners. I would like to remind all that the Berks County Residential Center was created to keep families together in humane conditions while they were awaiting results of their asylum proceedings. The county ensured that the residents were safe and well taken care of. Families received medical, dental, and psychiatric care, most for the first time in their lives. Children were being educated and the teachers ensured their progress. Report cards and records followed them to their new school districts when they were discharged from the BCRC. Children were also provided educational trips and leisure activities. BCRC ensured a humane transition period for families. I want to thank all of you commissioners for what you've done in the past, and if need be, in the future. Tanya Wenger, why I'm missing. It is unacceptable that the commissioners have submitted a white paper proposal to ICE regarding the Berks County Residential Center that was detaining immigrant families. Where is the transparency and accountability with us as your constituents regarding what you are proposing? Why did that not happen first? Why did you deny a right to know request to at least one reporter about this issue? What PA statute does not allow you to grant that request? Crystal Kowalski, why I'm missing. Good morning, commissioners. An article in last Thursday's Reading Eagle stated that the prison board is recommending hiring CGL to guide the county through the process of building a new facility. I remember hearing discussions of CGL managing this project since spring of 2019. I feel like I also saw a detailed presentation at a budget meeting in January of 2020. I am wondering if you can clarify the timeline of our involvement with CGL, the nature of their consulting, and the fees that have accrued thus far. Have the fees been negotiated to move forward with CGL? What are those fees? When do you believe you will be voting on a finalized contract? If you contract with CGL now, does that mean we will not be waiting until 2029 or 2030 to build the prison? Does engaging with CGL now mean that the process will start soon and the prison will be ready for use in 5 years? Last week, the prison population was below 700 people. I can attest to the fact that there are still people being incarcerated for minor infractions. As you plan, please keep this in mind. If we get rid of cash bail and reform probation and parole policies, we can reduce the population further. Most importantly, please do not consider any building option that would involve a private prison company. We have arrived at the moment where we can make a long-term brick and mortar commitment to end mass criminalization and mass incarceration in this county. It would be inexcusable not to do so. Thank you. Julia Minato, Reading. Is it possible to have Spanish interpretation at future meetings? Many members of our community are monolingual Spanish speakers, and if this meeting can be made accessible to them, then they can be as civically active as they would like to be, and we will be able to hear their voices during the public comment section. John Archer, Spring Township. Commendations to all of our Berks County Commissioners deserve our praise and gratitude for their continued efforts to provide a significant level of detailed information in the Commissioners' weekly meeting as to why they are making their decisions regarding various issues. A good example was the information provided on our landfill issue in Eastern Berks. Louise Grimm, why I'm missing. Good morning, Commissioners. It's with great joy that all of us advocating for the release of detainees at the Berks Detention Center learned that families have been released last weekend. The unlawful and immoral detention of people who were incarcerated for seeking asylum is over for these families, but the center still is not closed as far as we know, and its future remains a mystery. You have submitted a white paper dealing with the repurposing of the building, but have refused to share this request with our constituents. In the name of transparency, which you often advocate for, please let me know how you intend to repurpose this facility. I believe we have a right to know. Thank you. Christopher Ellis, Reading. Others will be more eloquent on this topic, but I am just cutting to the chase here. Repurpose the detention center. You know it's wrong. End the ICE contract, period. Becky Ellis, Reading. Per the March 1st article in the Reading Eagle entitled Berks Residential Center's Faith Not Known and County Officials Are Not Talking, the board approved sending a letter of support to ICE regarding a white paper proposal for the center, but the commissioners did not provide the public with information about what was contained in the letter or the proposal. Commissioner Kevin S. Barnhart, who opposes the continuation of the arrangement between the county and ICE to manage the facility, cast the lone vote against sending the letter of support without comment. My question is, what was in that letter? Why are you being so secretive as per the content? The content of that letter should be public knowledge. Also, why, if there are no longer families in that building, are you still maintaining a relationship with ICE instead of humanely repurposing the Berks Residential Center so that it is no longer used to imprison immigrants? If it is the $1 million income from the lease that is the issue, you can save several more $1 million to compensate for that loss of that so-called income by not building a new prison and working to reform the current legal and incarceration system. From the information I have gathered over the years, the Republican legislators I have spoken to have equated the detention center to a Ritz-Carlton where people staying there could come and go as they please with free medical care, food, and shelter. Let's try to be honest for once. If you yourselves would not live there, you should not be subjecting anyone else to these conditions which have caused immeasurable psychological harm to the people who have been imprisoned there. End the lease with ICE. Thank you. Adrian Jadick, why I'm missing. Dear Commissioners, I wish to commend you for establishing the Tri-County Passenger Rail Commission. It is no secret that train connections bring economic growth for those communities. And I will not mention the environmental advantages. I wish to ask you to do everything in your power to make those meetings available through Zoom or MS Teams so that the public can follow and contribute to those efforts. Finally, we seem to continue to have public comments from residents concerned about the past election. As I said before, I was an observer for 2 weeks and I witnessed an impeccable process. There was always place for better, but we need to patiently continue to assure the residents that no fraud or irregularity happened. I thank you for explaining over and over how the process went and how much care was given to provide the maximum traceability and accountability. Please keep doing so, as a large component of the public is fed lies and conspiracies, and we have to do our best to counter those lies. Celine Schreier, Reading. As commissioners, you have frequently talked about how you were concerned with public accountability, particularly in regards to voting rights. Where is that same commitment to public accountability with the Berks County Detention Center and white paper proposal that was signed and sent to ICE without public input or even notice? You know what public opinion has been. It has been made clear for over the years. Despite this, you have ignored your constituents and continued a legal battle to ensure its operation, which has been illegal since its license failed renewal in 2016. You are accountable to us. Release the proposal, shut down Berks, and begin the healing process for our community. Andrew Palomara, Reading, excuse me. What is the commissioner's plans for the detention center? We are getting ready to spend hundreds of millions of dollars on a new county jail. Why not repurpose the detention center for a public mental health facility to transition and provide essential care to our people instead of criminalizing them? Have you considered other options, such as a public drug rehabilitation center to help Berks combat the opioid crisis? You owe us answers, and this process has been entirely undemocratic. You all know this. It clearly communicates that the commissioners continue to lack basic respect for the community at large and our voices. Jess Royer, Spring Township. Good morning, Commissioners. I'm sure I'm not alone in wondering what your plan is regarding the Berks County Residential Center. We've heard that the center was emptied over the weekend with the detainees being sent to live with sponsors. What is to happen with the facility now? What will happen for the AFSCME 462 employees who work there? At last week's meeting, agenda item 73.2021 was adopt a resolution ratifying, confirming, and approving execution of a letter of support to the U.S. Immigration and Customs Enforcement for white paper proposal for the Berks County Residential Center. Based on that agenda item's vote, it would seem as though that letter was in support of Berks County continuing to operate some sort of family detention center in partnership with Immigration and Customs Enforcement. But unfortunately, we don't know what that letter contained. Please shed some light on the contents of that letter, and please share with the public your goals for Berks County as it relates to family detention. Dwight Wegman, Lower Heidelberg Township. Good morning, Commissioners. Election integrity is of the utmost importance. One of the main issues that needs attention is cleaning up voter rolls. And that concludes the comments in our Q&A. What's going on?
I was muted, so let me try that again. Comments are closed at this time, and I want to recognize Christine Sadler. Christine is our Berks County solicitor. She is going to share comment dealing with the white paper application and ICE. Christine?
Good morning, Commissioners. We've received many questions this morning regarding the white paper proposal and the letter of support that was on last week's agenda. So I'd like to add some clarifying comments. The white paper proposal was completed and submitted by ICE officials. The county is not in possession of the white paper proposal as submitted. The letter of support is an attachment to that white paper proposal. Per direction the county received from ICE officials yesterday, we are not permitted to release the letter of support that was part of that packet. All requests for these documents must be directed to the federal government via a Freedom of Information Act request.
And Christine, this is not something new. This is consistent with the contract we have with the feds and have had since I've been here, that we are not to provide public response, media response, that all of those media inquiries have always been turned over to ICE and the feds. And secondly, we did not reject the right to know request. We took the legal 5 days that we had to find out from the federal government what our obligation was, and you've confirmed that, so the folks can make that federal, in essence, a federal right to know request, correct?
Correct. And as soon as the federal government indicates to us that we can share additional details, certainly I know that's something that the commissioners plan to do. Just we need to get authorization from the federal government to do so. So at this point in time, we've not been authorized to make any further comment on that topic.
Thank you. At this time, I want to recognize Commissioner Kevin Barnhart. He is the head of our Berks County Prison Board and would like to make a comment on the Cgl contract, a clarifying comment.
So thank you, Commissioner Leinbach. To Crystal Kowalski, it's a very complicated process, but it's a multi-pronged approach. Yes, we did have significant discussion with CGL back in 2019 and even early into 2020. But for the COVID-19 pandemic, we probably would have been a little further along with the process. We have not been presented with any fees at this point. We have not agreed to any fees. That will probably happen in the coming weeks. The prison board was asked for their support to move forward with CGL. Ultimately, the fees or the cost incurred by the county for CGL will be a commissioner's decision at a Thursday meeting. They are asked to deal with the present conditions of the existing jail and the staffing and things of that nature, and then eventually move into the future potential of a jail. We have a lot of existing things that need to be dealt with, whether it's proper staffing at the supervisory level, at the maintenance level, and there are a lot of items to ensure that as we move forward and ultimately build a new jail, that the existing jail doesn't fall apart. So there have been discussions with myself and Pamela Schupp with CGL on trends that we see in the criminal justice system, a lot of it tied to COVID-19 and us going from 950 down to about 550 in June, and now we're at about 700. So we're down about 250 average daily population. Will these trends continue? Are there best practices out there nationwide that we've learned from going through a pandemic? So we're not rushing into a decision on building a new jail because there's an awful lot of new data out there as to what this future jail should look like and what it should include and not include. And back in the fall of this year, we graciously supported an effort by adult probation to increase the number of people out on electronic monitoring. That again then couples with hiring more adult probation staff to lessen the burden in the jail. So a lot of things we're learning, we'll still learn. There's a lot of discussion being held with CGL, but ultimately we will be engaging them to help us with preventive maintenance items, with things that need to be done, recognizing even if the new jail is out 5-7 years from now, there's still an existing jail housing 700 inmates and nearly 300 employees. We have to keep that safe and secure for the near term. So hopefully that answers your question.
Yeah, so in short, this is not the same contract we were looking at in January of 2020. That was a several $100,000 contract to go through the process of putting specs together, looking at various options, lease, design, build, lease back, etc. I can assure you a private jail is not on the table, period.
Yeah, this is going to be laid out more like a menu of options. We're going to go through the menu and start incrementally working on proper staffing, proper preventive maintenance and then we'll eventually get to the ultimate outcome, but that's not in the near term.
Yeah, this is down the road.
Yes.
My guess is we will probably not re-engage CGL on a new jail until anywhere from 1 to 4 years from now. Somewhere in that period, we're going to need to start, because this is based on the information they provided to us in the initial study. We're looking at probably a 4 to 6 year process beginning to end. So this contract is addressing existing staff and existing facilities.
Yeah, ballpark estimate at any new construction is about 2 years of planning and design and permitting, and about 3 years for the actual construction. So it's a long-term expectation, but not anytime in the next couple of weeks.
Any other comments?
Yeah, I just have a few here. There's in one of the comments it says that we should not build a new jail, which would save us millions of dollars, making reference to the revenue that would be lost by the BCRC. I just want to clarify, the new jail is not because the current one is too small. The new jail is due to the conditions of the old jail. And that's why we're looking at a new jail, but not because we want to have a larger jail to have more people in the jail. So just wanted to clarify that. In reference to the meetings being translated to Spanish, it's not something at least I have looked in, but definitely something to consider. So it's something I will keep on my radar and look into that and see what the options would be. In the midst, and one more, I know we have another meeting coming up, so I'll be brief. But in the midst of everything, I just want to take a moment to thank the staff at the BCRC for the work that they do there. They treat the residents there humanely. They treat them with respect. They love their jobs there. And my question would be for those who are saying that it's inhumane, that they're kept behind bars, that they're treated one way or another. I'm just wondering if they've ever had the chance to go and see the BCRC and how it runs and how people were treated there. It's one thing to hear of stories and another thing to actually go and see what's going on there. So again, I want to take a minute just to thank the BCRC staff for the work that they've done and how they've treated the people that have gone through that center. Thank you.
Thank you very much. Two things. First of all, I'm aware of some comments on our social media. Two things as a reminder. Everyone is limited to one comment. Number two, if you don't include your name and your municipality, the comment is not going to be shared. Thirdly, there was a comment that didn't include the municipality, asking why we can't bar highly political comments. And the answer is pretty simple. Who's going to decide what's highly political? Who's going to decide what's offensive? Now, understood, if somebody would use inappropriate language, etc., we're not going to read stuff like that. But we have to be pretty broad in providing opportunity for people to make public comment on issues that they believe are important. That's part of the respect for the public. One other note on the jail population, when we took office, and I think people forget and say we, when Commissioner Barnhart and I came into office in 2008, there was a significant expansion, not only on the books for the jail, but the bond had already been put out. The money was in hand. It was between $27 and $28 million expansion. Jail population was roughly around 1,300. And we asked a very simple question. What is this expansion based on? At the same time that expansion was planned, the Community Reentry Center was being completed. So that was providing capacity. We found out it was based on and I'm approximate here, Kevin, 4 to 5 year old study that was showing prison population continuing to climb. We asked for the latest data. It showed us the prison population was flattening. We killed the project. We didn't spend the bond money for something else. We sent the money back to the bond company. We refunded the money. 1,300 population roughly in 2008. And today, we've been, over the last couple of weeks, above or below 700. We've taken very seriously, along with our district attorney. We cannot walk around acting like we're the sole reason that the population is down. Our district attorney, our courts, our president judge. And in my conversations with President Judge Parisi, I continue to press for opportunities to limit the inmates of our jail to people that absolutely need to be in the jail, need to be separated from society on 2 years or on sentences of 2 years or less, or because they're being held on violent charges. And we are working together. I'm proud of the work that's been accomplished. Our APO, JPO department led by Bob Williams has really stepped up to try to do the right thing. Do we have more to accomplish? Yes, we do. But let's not forget where we were and what we were planning in 2008, an expansion of a jail well beyond the current capacity. And now we're looking at a jail population that is not quite, but almost half of where we were in 2008. So often I don't fully engage in some of the statements that are made, but now and then I think it's important to provide clear detail that this board isn't asleep at the switch when it comes to criminal justice reform, when it comes to using taxpayer money, because folks, county jails are like 99% taxpayer funded and out of local taxpayer dollars. So I don't know if any of my colleagues want to add anything. I know we have an election board meeting we're already behind, but it's important to understand the good things that have been accomplished so far.
Well said.
Anything else for the good of the order?
Motion to adjourn.
Second.
The meeting stands.